My name is David Semela. I proudly serve as the head of the hepatology department here at Health Ostschweiz. We have a large clinic for gastroenterology, hepatology, and many patients with ascites. Today, we will proceed to implant an IPC in a patient suffering from malignant ascites. This is a patient who is suffering from metastatic pancreatic carcinoma. She has undergone multiple paracenteses to relieve her discomfort, and due to the persistent issue of recurrent ascites, we ultimately decided to implant an intraperitoneal catheter, IPC. This will allow her to leave the hospital soon and regain her independence. It is incredibly crucial to ensure that deep anesthesia is effectively achieved. Wheals will also be formed in the region surrounding the incisions, as well as at the later locations where the sutures will be placed. Now, the cannula is carefully advanced into the peritoneal cavity while applying regular suction. Now, the cannula under constant suction is advanced into the peritoneal cavity. The Seldinger technique is used for this. It is essential to firmly secure the wire in place so that it does not accidentally dislocate or come loose. The cannula is carefully removed over the wire and the subcutaneous tunnel is made using the tunneler. Pressure and gentle twisting movements are used to advance the tunneler centimeter by centimeter towards the guide wire. The catheter is now being carefully pulled through and the tunneler is gently removed from the end of the wire. Now the catheter is carefully pulled subcutaneously until the polyester cuff is positioned approximately 1 centimeter away from the distal end of the catheter for optimal placement. Now the introducer is threaded over the guide wire and inserted into the subcutaneous tissue, where it is also advanced with gentle pressure and twisting movements until the tip of the introducer is located intra-abdominally. And now the distal end of the catheter is inserted over the introducer, and the base of the introducer is broken apart, and the catheter is pushed in centimeter by centimeter. The introducer is increasingly opened and retracted until the entire catheter is completely inserted into the abdomen. The catheter has a safety valve at the end. This can now be unblocked using the access tip, which allows the ascites to be effectively drained as needed. In the next step of the procedure, the catheter is securely fixed in place using 2 carefully placed sutures. These are a holding suture in the area where the catheter exits the body, and a skin suture where the catheter is sutured to the skin. Yes, in the end, we are glad that this treatment method exists.